Hi, my name is Bob Sorrentino, and I've created this short little video for anybody who's scheduled or contemplating on having knee replacement surgery. First, I would say to you, ask your doctor a lot of questions. Make sure you understand what's going to happen. In my case, I was not in a lot of pain. However, due to a previous surgery about 45 years ago, I did not have any cartilage left. And so it was bone on bone. And it wasn't so much the pain, is that my knee, as you could see from the before photo, was kind of buckling inwards. So it made my walking difficult. And also, I was starting to become unstable on that leg. And the doctor was concerned that I might fall at some point in time. So here I am, gowned up, ready to go. That was not a bad process at all. What was a little bit different from the surgery 45 years ago was the anesthesiology. What the doctor did was initially put a nerve block in my right leg. Then he did a spinal, an epidural. And then they gave me, a light sleeping gas, similar to what you would do if you were doing dental surgery. And he said the recovery from that is much easier. Uh, One thing I would suggest is you find out about that because it may impact your bladder as it did with me. And I had some difficulty while in the hospital running to the bathroom a lot. Uh, and then also, I wound up with a bladder infection later on, which was not fun, and I had to go to urgent care. But luckily, they gave me 10 days of antibiotics, and it all cleared up, and I'm pretty much back to normal. The surgery was a couple hours. Uh, Went back to the hospital room. They get you right up, standing, walking to the bathroom. That day, the next day, they had me sitting in a chair. Scheduled physical therapy twice a day in the hospital. I was there 2 nights. I did not have to go to a long-term rehabilitation. I was able to come home, and the hospital sent physical therapist 3 times to assess me, give me some basic exercises and things like that. Um, Here's the way my leg looked immediately after surgery. You could see it's all wrapped up. Once the wrapping came off, you'll see that there was a waterproof bandage. You are allowed to shower with that, although they don't want you to get it, like real wet. After a week, we had to change that. And then after another week, that comes off to stay open for another week until the staples came out. And so you could see what that looks like. And it looks scary with the staples, but it not as bad as it looks, and really wasn't that painful. One of the good things about it was, or at least in my case, I did not need to take a lot of painkillers when I got home. I would take an Oxy 5 milligrams now and then if I felt something. And they had me on a regimen of Tylenol. But all in all, it wasn't bad at all. Um, Once I started the uh, outside physical therapy, I was going 3 times a week. They kind of work with you on the exercises that you were given from the home physical therapist, and then expand on that there. And the place I went, very good reputation, only a mile away. They had a lot of really cool machines. One of them was a treadmill where they put on these shorts and they pump it with air, and they can make your body weight, or make it seem like your body weight is 50 to 100% of what it actually is. So, for example, in my case, he set it at 70%, so that when I was walking for the first few times on my own, um, I wasn't carrying my 100% body weight. Really pretty neat. I did have a walker for a week. I had a cane for about 2 weeks. They want to get, at least in my case, again, they wanted to get me off of that as quickly as possible. And I didn't want to use it anyway. So, everybody's different, but I think if you stay true to the exercises that they give you and follow what the physical therapists were, and again, that may be common sense, But if you do that, I think you'll recover quite well. Here's what my knee looks like today, about 8 weeks later. I could pretty much do everything comfortably. I'm walking okay. I did start riding based on what the physical therapist said. He tried me there. I am able to ride a stationary bike for like 25 minutes. Doesn't bother me at all. In fact, it helps a lot. And I'm doing elliptical about 8 minutes a day, and that was very painful when I started that. Stretching that knee out and that stride. And after about 3 or 4 days, the pain went away. I'm doing 8 minutes. I could probably do more. I've increased the stride. I think every little thing that you do is going to make you feel a little bit better. So, thanks for listening. I hope if you get the surgery that you recover quickly. Again, I would stress, stay true to the exercises. That's probably more important than anything else. And if you're looking for something to do, I'm an avid genealogist, and here's the link to my playlist at the end. Thank you.